So, how long have you been doing VT, vision therapy?
About a year, probably. Maybe half a year.
And who are you doing this with? Dr. B.
Dr. V.
So, before vision therapy, how was vision for you?
Well, at first I didn't really notice, but I guess I saw like double images of like two overlays of everything. Couldn't really see super well. I was told that basically only one eye was really working. So I guess it was like only like really half my brain was actually seeing anything.
And then, do you see the difference now after your vision therapy with Dr. B?
Well, nowadays, it's not necessarily that I see a main difference in terms of what I see. It's more of I see the results of what I'm seeing, what the results of both my brain having access to vision, because then now I'm seeing like my grades actually being easier to keep up than usual.
Oh, that's good. And like with these different exercises that you were assigned in homework, which one do you think impacted you the most?
Most likely the different versions of exercises where they have two different shapes and stick them together. Yeah, or you have to force them to stick together by like moving your eyes around and stuff like that. And so those two things really like basically force my two eyes to really stick the images together so I can go through the different questions.
And did you keep up with the homework that she assigned? Was it too much? Because you were our student, so how did you handle that?
Honestly, they're actually decently easy to come up with, at least in the latter half. The first half was just a little bit harder because everything was physically there, but otherwise it was pretty fine.
And then with vision therapy, would you recommend it for other students as well? Or like anybody who's having difficulties?
Well, if you're having difficulty with stuff, and you can't identify it, it's probably going to be based on the eyes. It's really hard to, at least for me, it was really hard to tell with me because I was only using one eye, but I couldn't tell that I was only using one eye because, because I would only see through that one eye, or I was only using that one eye for almost all the time. So when I went and got aware of that, then I could just really start fixing everything. So I'd probably recommend it to people who feel like they can't really identify the problem with their academics.
And then with the last closing remarks, would you like to make a comment on your 6-month to 1 year journey with vision therapy?
It's pretty cool.
Good. I'm glad it changed your life. Okay, thank you so much, Yoshi.